Thanks so much for being here. My name is Elizabeth Parks, and I'm the president of Parks Associates. And today I am so excited to bring Matt Johnson, CEO of EarlySense, to our virtual stage to talk to us a little bit more about the current state of the connected health market. So, Matt, thank you so much for joining us today and for EarlySense's support of Parks Associates research and events.
Yeah, thank you so much for having me. It's a pleasure to be here.
Great. So there is so much going on in the world of connected health. We have seen enormous transitions to virtual care and the big world of home and health coming forward soon. So if you could share a few things that you've seen going on in the market in the last 18 months. We've heard some experts say that we have moved, 5, 10, 15 years ahead, really, with the pandemic being a catalyst in the health space. So, what are some of the trends that you've seen in the last 18 months?
Yeah, no, I think that's right. I mean, I don't know if it's 5, 10, or 15 years, but I think it's definitely been an accelerated pace, and the pandemic has certainly accelerated those trends. I mean, I think you put it the right way, Elizabeth. It's this is sort of the continuation or the acceleration of some trends that have been present for a long time. Trends in the form of care moving from the hospital towards the home or towards points of less or lower acuity, and then also people taking a different and greater interest in their care. And so certain things I think that were trending have been kind of made permanent. Things like telehealth, companies like Teladoc and Amwell offer services where previously people would schedule an appointment a day or two or even weeks in advance and go see a GP or even go to the urgent care center. Companies like that, plus others, Dispatch Health, et cetera, have disintermediated that old model. And I think what that trend has done is it's accelerated people's familiarity with telehealth and connected health. And once people are familiar with this, they grow accustomed to it. After somebody's gone on a couple of telehealth visits, it seems crazy to make an appointment 2 weeks in advance just to drive down to a hospital and wait in a waiting room for a couple of hours while seeing your doctor. These things are now immediate and they're accessible. And so what that does is it kind of pulls forward a lot of healthcare from things that are planned to things that are sort of PRN or as needed. And so to us, that's a really interesting trend. And what it's done is it's made people comfortable with those different visit types. So sort of the quote unquote disintermediating the visit has been the perhaps the primary trend. But the secondary trend's even more interesting, which is that people are getting care in new venues, and those venues are often their homes. And so to us, that's sort of the acceleration or the permanence of that primary trend of the connected patient telehealth. And then the secondary trend, again, the more interesting factor is these new venues of care, real healthcare taking place in the home, as opposed to just the scheduling of care taking place in the home.
Yeah, absolutely. It's quite a transformation that we're really in the middle of. And our data does support what you're saying. 64% of all consumers in broadband households now have had a telehealth visit, which is up from 200 from 19% just a few
Right.
years back. All of this does speak to this new model of care delivery and really that consumerization of health and meeting
Right.
the consumer where they're at, as well as really working to keep hospital beds open. And certainly with the pandemic situation, there is a focus on making sure that, there's enough space for those who need it. And so that push back to the home to help in areas where possible, I think is going to continue. It does also speak to the role of technology and how important that's going to become in remote patient care. So I'd like to offer you the opportunity to share more
Sure.
about early census technology and really where this fits into this new world that we're in.
Yeah, I mean, I just couldn't agree more, right? The first of all, the expectation, sort of the consumerization of healthcare, has accelerated through this process. And so what that does is it leads people to ask questions about being an active participant in their own care. So things like broadband, things like 5G have made this stuff easier that used to be really technologically difficult. And so we've sort of broken through those boundaries. And now people are saying not only, how can I make care more convenient, but how can I be an active participant in my own health? And how can I make this the sort of what was previously the sort of episodic interaction with a doctor or with a hospital, with another care provider. How can I make this continuous and make it a part of my healthy lifestyle? And frankly, those are really favorable and positive trends. And so it's the technology, kind of the connective tissue of broadband technology is a critical element of it. But also the kind of the ubiquitous availability of these kind of novel sensors migrating from areas of high acuity like hospitals to the home is a really significant trend, and we play right in that fairway. So EarlySense used to be solely focused on care of patients in the hospital. We have a contact-free continuous patient monitoring device that without any interaction from the patient captures the heart rate and the respiratory rate of a person, and through our machine learning and AI can tell if that person is actively deteriorating, so caregivers can intervene quicker for better health outcomes. And so we did this a few million times with a few million patients in hospital beds, and we started to ask the question of why stop there. And so we went into areas of lower acuity like skilled nursing facilities and long-term care facilities, and only recently we've migrated this technology to the home setting, which from our standpoint is the most exciting application of the technology, because the invisible nature of our sensors means that we can capture this really valuable continuous data and learn a lot about a patient and really keep them out of the hospital and keep them healthy without asking anything from them. So no compliance needed. There's a lot of upside there. And I think that ties off to a really important consumerization trend, which is that people want to be involved and active participants in their own health, but they want to do so in a way that fits into their lifestyle. That's how this trend becomes permanent.
Yeah, absolutely. The sensor-based technology really enables consumers to have a better understanding of their health and wellness, even before there is a problem. And I think, when we look at the market, the seniors, the older consumers who, really always want to be in their homes. I think our data says something like 82% say they want to stay in their homes, but in my mind, it's, who wants to move out of their house to move into a
Right.
facility?
Right.
100% of people really want to be at home and live independently. And technology and sensor-based technology that has AI built in, predictive and proactive analytics is going to, really transform the ability for older consumers to live safely in their homes. We do a lot of research on the caretaker market and caregivers, and our latest data actually out of Q3 shows that 22% of broadband households, or about 25 million households, are in the position of caretaking. And so when we look at
Wow.
technology, can you share a little bit about, where you all see the caregivers and caretakers with some of these older consumers, and that role that sensors are
Yeah.
really going to play for the future?
No, absolutely. That's a staggering number. I had no idea. We knew it was high. I mean, I think all of us sort of inherently know this because we have loved ones that require an occasional check-in or even more intensive care. No, it's 100% right. I think to say that when people say they want to stay at home, they mean it. And even if that number's not it's 82%, not 100%. I think that last 18% would maybe move once, but not again. And so a senior housing residence is a home just like the home where mom and dad raise the kids. And so I think that what we all want to do as caregivers is we want to make promises to our loved ones that say, hey, look, mom, we can provide you the care that you need in a timely way. But also we have to make, as an implicit part of that promise, we also have to let home feel like home. It's not an acceptable promise to say, we can always guarantee you the care you need, but it's going to be in an institutional setting that really never feels comfortable. That's not a win. And so I think that the baby boomers who are retiring and or who are entering these phases potentially of needing care have pretty high standards for what a comfortable life at home means, and their kids, people like myself, have this overwhelming sense of responsibility that we should be able to not only provide them a safe place to live, but also a lot of security, both for ourselves as the caregivers, but also for our loved ones. That says, look, we know the important trends, and we know the important signals of deterioration long in advance of having an accident, a fall, or a clinical event that requires something more than what we're providing. And so I think that that is the place of that's where sensors kind of fit in, right? So it's this notion that when you engage with a person in their home, that you should be able to, without requiring anything of that person, any sort of wristband or action that they have to take every day, we should be able to just sort of know, based on the virtue of the sensors existing, how that person's trending and how their health is. And so the better that we can do at that, the farther back we can pull any clinical deterioration events, then the better we can do at providing caregivers the tools that they need to take better care of their loved ones. And that's precisely the goal. And by the way, that has two major benefits in addition to the obvious ones. Number one, like you said, people want to live at home, and kids want to make those promises to their parents that you can live at home and this is the right place for you. But also, what we all know is that as people age, their care becomes more expensive, and we know that chronic illness is more likely to show up in older adults than younger ones. And we also know that most chronic illnesses don't become expensive until the chronic illness becomes acute. And so all of what we're really saying here is not only are we taking care of our parents in a way that makes them happier, but it also makes them healthier and it makes them less likely to end up in the hospital. So we're saving the health system a ton of money.
Well, I love everything you just said. This is one of my favorite topics that we study at Parks Associates because the impact is so large, and really for those older consumers who, everybody has, and eventually we will all become. The role of technology is just it's so vital, and like as you said, those understanding vital signs and being able to really be predict things before there is an outcome is really amazing what technology can do. That's going to have to be the end of our conversation today, but I want to thank you so much for your support. We are excited to be sharing some research with the world that was commissioned by EarlySense, and so look forward to releasing that soon, and want to thank you again for joining me today.
Yeah, thanks for having me. Pleasure is mine.